not a doctor, but an assisting nurse at the time. There are many memories from just 12 months working in an hospital. Top 2, obese farmer, rubber boots he couldn't get off for like 2 months, severe diabetes. I was assisting as the boots were cut off, both feet awfully swollen, on the left foot's toes all dead and partly rotten. No wonder he felt some weird pain down there. Second, explosive diarrhea from a patient, with an iron problem in his blood. He sprinkled the whole bathroom with his dark and bizarrely smelly feces, as he tried turning around to the toilet on time. Poor dude, wasn't foreign, just got a new hip joint, was so sorry and embarrassed. Literally saw someone have progression of a stroke in front of my eyes. My intern tells me that she's concerned about a patient, because since the previous night he's had some right arm weakness. We go see him together. When starting out he is talking perfectly normal, but then all of a sudden he starts slurring his speech, and half his face droops. Immediately called a stroke code, but he was outside the window for emergency intervention since his symptoms started the night before. I don't mean to be critical of someone I don't know, but wouldn't you normally expect a medical intern to have recognized the stroke the previous night? Edit. I misunderstood the timeline. The intern wasn't there the previous night either. I watched my mom go through her stroke. As a teenager, it fucked me up for a while. Seeing her unable to speak properly, and look so confused, like she was a child all over again. Just horrible and scary. I was the patient in this case. I had come in because of a headache, and my sick call doctor had asked me to get a CAT scan. I drove to another hospital to get one as they didn't have one on base. Everything seemed okay, and while we were waiting for the results, one of the nurses had brought me some medicine to help with the pain. Just as I was about to take it, another nurse, practically superwoman, dived into the room and slapped the pills across the room. She then started telling me that I needed to lay down, and they were going to immobilize me, but that everything was going to be okay. Turns out my brain was bleeding, and the medicine would have probably killed me right there. I'm sure the nurse, after seeing the results, must have at least thought, oh, because she looked absolutely panicked when she first rushed into the room. After the pills were out of the equation, she was very professional and quick. Kinda wish the happy juice they gave me shortly after hadn't been so strong, so that I could remember her name and thank her. I'm not a doctor, however every year I ask one of my family members, who is an ER surgeon, to tell me the most unique injury that he has operated on that year. One year, a young man was driving in icy conditions, wasn't wearing a seatbelt, slid to the road, and crashed into a telephone pole. He was ejected, and flew into a barbed wire fence. When the individual arrived at the ER, my relative was given a cooler. Inside was the guy's face, that was sliced clean off from the fence. His job was to quickly pick out all the debris from the face, and rush it into surgery to reattach it. Long story short, wear your damn seatbelt. Pediatric resident here. During my time in the NICU, I had several moments. I think every one of us does. In one of my first night shifts, a 500G preterm newborn, on non-invasive ventilation, stopped breathing. I immediately started to bag her, which usually works nicely to stabilize the patient. Didn't work this time. I had the nurses call my attending to get here ASAP, but he was about 20 minutes away, which was way too long for the patient. I had to intubate an extreme preterm baby on my own for the first time. The patient became bradycardic very quickly. The nurse started chest compressions, while another nurse handed me the laryngoscope. For some reason I stayed relatively calm, and just thought, you better not this up. I successfully intubated on my second try, heart rate shot back up, O2 saturation followed shortly after. We put her on a ventilator, and when we were all done my legs just gave out. I had to go back to the doctor's room, my whole body was shaking. There was a clinic patient with a colostomy, who was not performing good maintenance. He used to tape a plastic shopping bag over his ostomy. You would smell him before you saw him. There was no amount of mint oil on the planet that took the smell away from the room, and it hung there for days. It also didn't help that the guy was a raging putz, who was non-compliant, and likely on drugs. Not a doctor, former EMT here. Had a patient who was sore below. Partner I taking bets en route, that it was something inserted in back passage. We were wrong. He had something inserted inside his foreskin, a car headlight bulb, which had smashed with him yanking away, and was bleeding heavily. Packed the area, and ED removed glass, filament, metal penis started spurting while the poor bee screamed, heard someone cracking jokes about it, not being his brightest idea, as we left. Not a doctor, but when I was delivering my oldest, the nurse caring for me, had just got done telling my husband to settle down, the baby wouldn't be coming for hours. She then checked my dilation, to prove her point to my husband, uttered the words, "Oh, there's the head," and ran out of the room to find the OB. That happened to my mum. The nurse made her take a shower, and all the while mum kept insisting the baby was coming. The nurse kept dismissing her, until mum just sat down on the floor of the bathroom, and was like, "You, I'm about to start pushing, why would anyone take a shower before doing that? That's like cleaning your house, because a tornado is coming through. Warm water helps you relax. Some hospitals have showers, others have bathtubs. Or you can choose what you prefer. Not about being clean at all. Really helpful during labor, if taken at the right time." During one of my interns a man walked in because he had swelling down below. I did not know what to expect other than the routine complaints, being some benign swelling, or some inflammation. I don't even know how to describe what it looked down below. When he lowered his pants, his scrotum was as big as a melon, with open wounds oozing all kind of colored liquids. I've seen and smelled some literal shit, but the smell almost made me gag. I referred him immediately to some uro-oncologist, for a medical checkup. He had a rare penis carcinoma, with metastases spread all over his body. The man was in severe pain, and was so ashamed to go to a doctor with his symptoms, until it was too late. He didn't live for long anymore. I think he didn't live for another 2 months. So ashamed to go to a doctor with his symptoms, until it was too late. This always breaks my heart, to read something like this. People need to realize, that these docs have seen it all, probably multiple times. There's no shame in getting help, when it's needed. Thanks a lot for watching, subscribe to our channel, and if you're a doctor, tell us about the trash stories that made you think, oh